We're all human. And it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships, while the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show. The focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida and beyond, all over the world. You're listening to iHeartRadio, and a warm welcome to Doctors Are People Too. My name is Patty Vila, and I am filling in for the fabulous Dave DePino, who is having a wonderful vacation with his lovely wife. And I want to just remind all of you, if you want to call in, to call 1-888-565-1470. With me tonight, I have Dr. Eric Beyer from Florida Medical Center. He is the medical director of the Cardiothoracic and Vascular Surgery Department at FMC. Good evening, Dr. Beyer.
Well, good evening. Thanks, Patty, for having me. Appreciate it.
Thank you for coming. The first question I want to ask you is, how was it growing up in South Florida?
Oh, I loved it, man. I really enjoyed it. I was born in South Miami Hospital, actually, off of US 1, and was raised in South Miami, and just enjoyed every bit of living in South Florida. Had a lot of friends that, the families had boats, and we do a lot of fishing, and whether it was in the Everglades or in Key Biscayne. So really just enjoyed, every aspect of living in South Florida.
And where did you go to medical school?
I went to medical school at the University of Tennessee, actually, in Memphis, Tennessee, which actually, there's a story behind that. I grew up in Miami until I was about 13. My dad worked for Eastern Airlines at the time. And, anybody that grew up in Miami in the 70s probably has heard of Eastern Airlines. And they went bankrupt, basically, over the course of into the late 70s, into the 80s, and my dad was laid off and took a job with Federal Express, and that took us away from South Florida, unfortunately. And so I grew up in the rest of my life was in Tennessee. So I went to undergrad at the University of Tennessee and medical school at the University of Tennessee as well.
Well, let's dive right into the questions about matters of the heart, because I know that that's your passion, and you're always helping people. What is coronary artery disease?
So, coronary artery disease, it's one of the most common disease pathologies that I treat as a surgeon, as an open heart surgeon. And coronary artery disease is just blockage of the arteries that carry blood flow to your heart muscle. So your heart is a muscle, it's a pump, and it requires oxygenated blood and nutrients for it to pump. And if those arteries that carry that blood flow get blocked off, then blood flow does not get to the muscle, and the muscle can die. And when the muscle dies, we call that a heart attack or a myocardial infarction. And people typically have chest pain with that, or sometimes if you're a diabetic, you don't have chest pain and you get short of breath. But that's basically what coronary artery disease. It's blockage of the arteries that carry the nutrients to the heart muscle.
And what treatment options are available?
Well, there's a lot of treatment options over the, it used to be a long time ago before there was open heart surgery. You basically told grandpa he was going to stay in bed for the rest of his life and take it easy. And there was not a whole lot you could do. And then in the late 60s and early 70s, as heart surgery became more commonplace and safer, bypasses were performed, most notably. There was Dr. Denton Cooley out of Houston, Texas, was really a big pioneer in coronary revascularization, along with Michael DeBakey, also in Houston, Texas. And I was fortunate enough to train actually with both of them, but they developed actually the techniques that we use today to perform bypasses. So that's one mode of therapy, is actually having open heart surgery. And in the 80s and 90s, they developed stents, and stents are devices that are deployed inside the artery in order to prop the artery open. And those are also very useful, and it's a way to avoid surgery, obviously. But there are times when surgery is recommended to bypass a blood vessel, and there's times when stents are recommended. And And so it's important that you have faith and trust in your physician that they know when to do that, to perform either one of those procedures. But I perform only open heart surgery, so I perform the bypasses. I don't put stents in. Cardiologists put stents in. So.
And when you do the bypass surgery and you have these patients, what lifestyle changes do you tell them that they have to make after surgery?
Well, it's interesting. It depends. It really depends on when people come to me with coronary disease. That's one thing I think I focus on is I tailor, every recommendation to the patient. If I give you an example, there's been some famous people over the years that have needed bypass surgery. One is obviously Bill Clinton, who is now in Philadelphia or about to be in Philadelphia to give some speeches, and but he actually as a relatively young man, he was in his I think late 50s, early 60s, needed bypass surgery. He had chest pain and was admitted to a hospital in New York, and then underwent coronary artery bypass surgery. And he has made some very dramatic lifestyle changes. If anybody's been following politics knows, you just look at him, look at Bill Clinton. He actually decided to kind of take a very drastic approach to how he was going to change his lifestyle. And one thing that he has done is he's cut out all, animal fats in his diet and essentially has gone on this plant-based diet, which if you adhere to it and strictly adhere to it, you shouldn't develop coronary disease, believe it or not. But there's not a lot of people willing to take such a drastic approach to their diet. So, people that are older, I typically recommend that they lose weight, that they cut out some of the fats in their diet, particularly the saturated fats and the animal fats, and then their diet cut back on them. And stop smoking, of course, that's the most important one. And then, get a little exercise. Those are the keys to really staying healthy and away from open heart surgeons. So.
And what is the recovery time? What is it that you tell your patients, when they're going to recover besides the diet and the exercise? I mean, what else? Because there is an emotional attachment to, when one goes through this experience.
Yeah, that's an interesting point that you bring up. Is usually after open heart surgery, when we do the full sternotomy, when we open the midline of the chest, people are recover. They are in the hospital typically about 4 or 5 days, and then they go home, and it takes a couple of weeks before they start feeling like they can get around a little bit. Usually within a month they're driving, and then they're allowed to start lifting things at about 6 weeks. There are other options. We do have the ability to do minimal access bypass surgery as well, which people tend to recover from quicker, where we use a kind of a hybrid approach to dealing with coronary disease. We'll have maybe a cardiologist put a stent in and then bypass a blood vessel that called the LAD, a very important blood vessel. We as surgeons will bypass that. So there's a lot of variations to what we do, but for the standard, open heart bypass surgery, we, people typically take about 6 weeks to kind of fully get over the surgery. And then there are some emotional components to it too. I have to admit, I've seen men who, their family relates to me that they've never seen them cry before, then they're starting to cry after the open heart surgery. And it's usually a transient, a form of depression that we see sometimes in patients that undergo open heart surgery. So. And
I know something you're passionate about is AFib.
Yes, that's right.
And we see all the commercials on TV regarding AFib. Can you tell us a little bit about that?
Yeah, that's an interesting disease process. I've spent a lot of time focusing on in my career has been atrial fibrillation or AFib, and obviously we hear a lot about it on TV, and you see all the commercials with atrial fibrillation being this is a problem and you need to be on a blood thinner, and it's true. Basically what AFib is, it's a rhythm disturbance, or what we call an arrhythmia, and what that means is the heart normally beats in a very rhythmic way. The two upper chambers contract, and then the lower chambers relax while that's going on, and then the lower chambers contract and the upper chambers relax, and that's just kind of the whole all day long. 80 beats a minute. We're seeing the upper chambers contract and the lower chambers then contract after that, and it's very rhythmic. It's a boom boom boom, 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 boom. It should happen in a very rhythmic fashion. And when you have an arrhythmia, you get out of sync in that rhythm. And AFib is a particular rhythm that really focuses on the two upper chambers of the heart. It's when they are quivering, essentially. They are not contracting very well, and that can cause people to be short of breath. It can cause them to be dizzy. It can result in strokes. And so that's why we focus on AFib so much. It's not so much that people die from the arrhythmia itself as they have a tendency to have strokes. They have an increased incident of strokes. And so we treat them with blood thinners and we treat them with medications. But certainly as a surgeon, I can treat AFib and cure AFib with a procedure known as the Mays procedure, and it's a very effective way to treat that. But it's again, every patient is different. You have to tailor your recommendations to the patients. And but atrial fibrillation certainly is as we get older, it becomes more common.
Are you seeing patients in their 40s having these types of problems as well? Because I've been reading about people in their late 30s and 40s having heart issues as well.
Sure, you can have people that develop AFib in their 40s and 50s, and obviously that's wrong. And certainly you can have people develop coronary artery disease. And the youngest person I've operated on for bypasses is a 28-year-old man, and so that's extremely young. He had a familial history of coronary artery disease, and was a heavy smoker, and so didn't help his cause out, and was obese. But certainly you can be very young and have blockages in the arteries of your heart, and AFib can develop in patients very young as well. It's not so common, but it certainly can happen.
And tell us about the fabulous work that you're doing at Florida Medical Center, because I know you're doing a lot of innovative things there. And tell me at least one before we go to commercial.
Yeah. Before we go to commercial, one thing that we are doing right now is a lot of mini access heart surgery. Instead of dividing the sternum, we approach valve surgery and AFib surgery through small incisions in the chest where we don't even break any bones. We go in through what we call a minimal access port, and it as a surgeon I feel very comfortable doing that. I do a lot of them. And it's certainly a nice way to take care of a problem without having to do a sternotomy on somebody or opening the middle of their chest open. So
okay, I just want to remind our listeners that we're with Dr. Eric Beyer from Florida Medical Center. If anybody wants to give us a call, they can call 1-888-565-1470. We'll take a short break and we'll be right back with the fabulous Dr. Eric Beyer.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Shands, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum in that it involves rhythm problems such as atrial fibrillation, heart disease such as coronary artery disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which involve trying to convert the patient back to a normal rhythm if they have an arrhythmia. I also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. And diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultra monitoring, and general cardiology office visits. We really pride our practice in its staff, who are very courteous and professional. We believe that under our care, you'll feel the same way too.
You are listening to Doctors Are People Too with David DePino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Hi, my name is Patty Villa, and I'm filling in for Dave DePino, who is on vacation this week. And with us this evening, we have Dr. Eric Beyer from Florida Medical Center. Thank you for being with us tonight. We want to talk about valve disease. Can you tell us a little bit about that?
Sure, yeah, I'd be happy to. There's really three valves that I commonly, deal with in my practice. And, we can break it down into each of the valves. That might be the easiest way to do it. But, aortic valve disease is a very common valve pathology. It's the valve that it's the last valve the blood sees before it ejects from the heart. So the heart will squeeze, and cause a contraction, and then the blood will eject out of the heart past the aortic valve. The aortic valve should open very easily and then close very nicely, so that no blood comes back into the heart. So that's what its function is. It's it's to allow blood to escape from the heart, but not go backwards into the heart. And actually, over time, one of the most common valvular pathologies is what we call aortic stenosis. And those leaflets that are supposed to be very kind of loose and flimsy and open easily and close nicely, they become very stiff and calcified over time. So they get when I say calcified, they get like rocks. I mean, they really do. If you've ever taken one out, you know what I'm talking about. It's very bulky and has it's very thick, and so the leaflets don't open very easily. And if the leaflets aren't opening easily, then what happens is the heart strains to kick out blood out of the body, and that can lead to a whole host of other problems. But typically, people are short of breath. Some of the later stage findings of aortic stenosis are when people pass out or they have chest pain. Those are kind of later stage findings of aortic stenosis. So, it's important to get checked out by your doctor regularly because, if he hears a murmur, then they might want to get an echocardiogram and kind of determine, if that valve is a problem. And the reason why I bring that up, Patty, is because we live in South Florida, and our patient population is kind of older than maybe if you lived in Arkansas or somewhere else, and this is a disease pathology of older people. So that's why I bring it up here, and the therapies we're approaching very new and exciting therapies that we do now currently today that deal with this problem.
Right. I was going to ask you about the treatments. Yeah.
Yeah. Well, actually, it's interesting. There are some famous people out there that have had aortic stenosis that our listeners may know about. Barbara Bush. Going back to politics, I didn't want to leave. Didn't want to leave the Republicans out of the picture. But Barbara Bush is an example of somebody who had aortic stenosis, severe aortic stenosis, and she had actually open heart surgery and had her aortic valve replaced with a PIG valve. And the reason why I know so much about it is actually was at the same hospital where she was, but it's obviously very common knowledge. This was publicized in the papers, so I'm not revealing anything that isn't out there in the public. But she had an open heart surgery, and she was in her 80s, and she did very well. You can see she actually looks better than George Sr. right now whenever you see them together. And she had her surgery, 5, 6, 7 years ago now. Barbara Walters is another person. You can see the theme. These are older people.
Yes.
They've had. She also had aortic valve stenosis and had her surgery in New York, and also had a tissue valve replaced, and she's done well following that surgery. Two other famous people that I know about are Robin Williams. Actually, he was down, I think, in Florida when he was jogging and had severe shortness of breath, and then was treated up in Cleveland for his aortic valve problem. That his valve was replaced with surgery. And then there's Arnold Schwarzenegger, also well documented. Had aortic valve problems. Has had his aortic valve replaced with a human aortic valve known as a homograft. And so, there's, it's interesting. This is a, when you start thinking about it, you realize there's famous people that probably all of our listeners know about. They've all had this open heart surgery. But nowadays we're moving into newer technologies, which is great because we're a part of these trials at Delray Medical Center and the Florida Medical Center, where we actually are putting in valves that go through your groin, and they're known as TAVRs, which is transarterial valve replacement, and so this is exciting times in open heart surgery and treating valvular pathologies, where we're placing these valves inside the native valve, and patients are going home after 2 days or so in the hospital, which is exciting. So that's the aortic valve.
Yes, no, and I'm sure our listeners are taking notes and listening to everything you have to say because you're really giving good information.
Sure.
And I just want to mention that if anybody out there wants to call Dr. Beyer, they can connect with him at 866-498-5433. I want to repeat that again, 866-498-5433. He's at Florida Medical Center. I know you're doing some interesting work with Dr. Kenningsberg.
Yes.
Can you tell us a little bit about that too?
Yeah, it's exciting stuff. Dr. Kenningsberg is a electrophysiologist, and he's a cardiologist by training, and then he specialized in rhythm disturbances of the heart. So it's a very, very focused specialty that he's involved in. And so we cross paths because we both deal with arrhythmia problems. And of course, he deals with arrhythmias using catheters, and I deal with them using surgeries. And there are times where our specialties, come together in treating individual patients. And so
That's okay. Your phone is ringing. I know you're a very busy man.
Yeah,
You're a very busy man.
So one thing that Dr. Kenningsberg is doing is treating AFib with ablation technology through the groin also. There's also devices to take care of what's called the left atrial appendage. And the left atrial appendage is that area in your atrium or those upper chambers of your heart which can have clotted blood in it when you're in AFib. That's why we put people on these blood thinners. So there's new devices out there that they put inside the left atrial appendage known as a Watchman device. So there's just exciting stuff going on with the way we're dealing with these problems, and Dr. Kenningsberg is a colleague of mine, and I love working with him. And it's nice having surgery and cardiology work so closely together.
And I want to go back because before we took the break, I was asking you about the innovative work that's going on at Florida Medical Center.
Yeah.
Could we just touch upon a little bit more about what's going on there?
Sure. So
because I know you work with fabulous people over
right,
there.
Yeah. There's so many great cardiologists that we work with there, and one thing that we are doing there that I think is very innovative is we're approaching, we talked about aortic valve, and I'm going to shift gears and talk a little bit about the mitral valve, which is the valve that's between the upper and lower chambers of the heart on the left side, and it's known as the mitral valve. And that valve can leak. Instead of it, it can become stenotic like the aortic valve, but the most common pathology in the United States for mitral valve is what's called myxomatous mitral valve disease, and that is basically where that valve the tissue is weakened, and the valve will begin to leak because of and I'm not going to get into all the details, but it'll start leaking because it'll prolapse or not hold its position where it's supposed to. And so the ways that we used to go about treating is do a sternotomy and then go after it that way, which is opening somebody's breastbone. But now we do these procedures through very small incisions on the chest wall, and we can approach them in that way. And what's called mini access mitral valve repair. We can do a maze procedure at the same time if somebody has mitral valve pathology as well as AFib. And all of that can be done through tiny incisions in the chest. And so what we do is we make a little incision, or just lateral to the nipple on the chest on the right side, and we approach the heart that way. It's actually a very nice way to approach the mitral valve. You're kind of in line with the mitral valve, and it's a very comfortable approach for me. and it's exciting because there's not a lot of centers that do that with a lot of frequency, and we certainly are doing that a lot at Florida Medical Center. And so I'm excited about that, along with the AFib procedures, doing them through small access incisions. There's just not a lot of centers doing it, and so it's exciting to be able to be a part of that and get our team up and running, which we're doing, and move forward and provide something for South Florida that not all centers do.
Absolutely,
Yeah.
and the community is so lucky to have you here in South Florida.
Well, it's nice of you to say. I'm lucky to be here, to be honest with you. I'm every day I'm so happy to be back in the area that I was raised in. So it's a nice feeling to be back here.
Well, the show is called Doctors Are People Too.
That's right.
So I want to ask you, what is your passion?
Well, yeah, that's a great question. I actually have probably two passions. One is this sounds kind of quirky, but I like editing videos, believe it or not. So I take a lot of surgical videos, and I kind of pride myself on getting getting good shots, close-ups, so that it'll draw patients into the procedure that we do. So I've published a lot of videos in national meetings and gotten them on dockets, and then I decided why not start a little YouTube channel. So I kind of started up a little YouTube channel with interesting cases or common cases that we do, so that people can and patients actually, some people don't ever want to look at surgery, and then there's a good chunk of people that actually like looking at this and trying to understand what I'm doing, and they get a better idea by watching the videos. And I really pride myself on that. When somebody tells me that they've seen a video and they learn something, that's a big bonus. So that's one thing I like doing. Believe it or not, it's a little oddball thing that I do. But another probably more common thing that I think other people can relate to is I like to get out on the water. Any time I can get on a boat or out snorkeling off the beach or go fishing, I try to do that. I have a 5-year-old son, so he's now starting to get to that age where he's holding his attention span and actually enjoys going out and fishing. And it's nice seeing his face because it reminds me of me when I first started fishing in South Florida, and that excitement that you get when you pull a fish out of the water. And so that's another thing that I really enjoy doing, is going out and fishing. So.
Well, thank you so much for being with us tonight.
Sure.
And I just want to let our listeners know that if they want to connect with you, to please call 866-498-5433. And that Florida Medical Center is located at 5000 West Oakland Park Boulevard, and you're always available. Thank you so much for being with us tonight.
Thanks for having me. I really appreciate it.
All right. Thank you, and good night. Oh, that was...
I make a dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm gonna stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking, and all this other, I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I described like an angel. I described like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red wine, that light red wine. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I want to live. I think that God gave me one more chance in life, and I had to take advantage of this.
You are listening to Doctors Are People Too with David DePino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Hello, South Florida. My name is Patty Villa, and I am filling in for the fabulous David DePino, who's on a wonderful vacation with his lovely wife. Tonight, we have with us in the second part of the hour, Dr. Fernando Bayron. Good
Hello,
evening.
Patty. Happy to be here again.
I'm so happy that you're here, too. I wanted to start off the show by you telling us a little bit about yourself.
Well, I'm Puerto Rican, as you know. I've been in this show before, and that was a big topic last time I was here. I've been living in South Florida for 10 years now. I work in Broward, and I do love what I do because doctors are people too, and they love what they do.
That's true.
And I'm a general and bariatric surgeon. I do weight loss surgery, and I do general surgery. I do robotic surgery, every kind of laparoscopic surgery.
Let's talk about the bariatric surgery. Who should be the person that's considering this type of surgery?
Bariatric surgery is something that has become a main topic lately because now we realize how important it is. It is basically designed for those people that cannot attain weight loss medically and because of their excess weight develop comorbidities. That means other diseases, say diabetes, high blood pressure, or severe obesity by itself that is considered a morbidity by itself.
And what are the different types of bariatric surgery that you, because I know that one is the balloon, that you do the balloon at Florida Medical Center.
Yes, there are many things there. Nowadays, there are many interventions that we can do. Some of them are tailored to different segments of the population. So let's start with the balloon. The balloon is not a surgery per se. It's an endoscopic intervention. It doesn't entail surgery. It entails an endoscopy. You get sedation, so you basically are awake. We pass a scope into your stomach, and we leave a balloon filled with water, if you may, to help you lose weight. That is intended for people that have a BMI between 30 and 40. BMI is a measure we use to classify the severity of obesity. It stands for body mass index, and it's a measurement where we calculate how much you weigh in regards to how tall you are. Say if Shaquille is here and he is 210 pounds, he may not be overweight, whereas somebody who is 4'9" at 175, they may be obese. So this is the simplest procedure. It's meant for people who are 30 to 40. Ideal body weighs 20 to 25. So those people are not morbidly obese, are obese. A step before being morbidly obese, and that is what that procedure is indicated for. Now, when you go above 40 or 35, if you have any severe condition that we believe that may get better by losing weight, then there are basically three options, and that would be a lap band, the famous band that we place by laparoscopy, a gastric sleeve, which is basically a reshaping of the stomach to make it smaller, or a gastric bypass that is something more involved where you make a smaller stomach and you bypass a segment of the bowel so you have less absorption.
And when you have the patients come in and they see you and they are thinking about doing this surgery, what kind of advice do you give these people?
First of all, we assess them medically to see. We want to know many things. What is their medical condition, to be realistic on what kind of expectation we are going to be able to offer this patient. We want to know if they have been serious about their weight loss efforts, because even though, and I quote very commonly, and a statistic that is there is very scary, if your BMI is over 40, and you try to do a diet, the chance of you losing weight permanently on a significant fashion in reality is less than 2%. Our hormones don't help us lose weight. However, you may ask me, if you're over 40 and you came to a surgery, why do you care if you did diet? Because, I mean, you're telling me that they're not going to lose diet with diet anyways. Well, because it's a lifetime commitment, as you mentioned at the beginning. And I want to know if you have struggled, you have tried, and you have not been successful, because in reality, your biology is not helping you. But at least I know about your commitment, and I know that you have what it takes. As opposed to the person that woke up today was happy with the way they were waiting always, and they said, well, today's the day, I'm going to take care of this. Let me go by Dr. Bayron. He's going to fix me. It takes more than that. And that part is emotional and mental and behavioral. And that's what tells me when people prove to me that they have been doing a diet before.
And I just want to remind the viewers that we're here tonight with Dr. Fernando Bayron. If anybody has a question that they want to call in and ask the doctor, our phone number is 888-565-1470. So please call in. I always think about the emotional part of having a surgery. And what is it that you tell your patients from the emotional part of it?
Well, that there's so much to say about that, because if you think about it, eating is a behavior we do 3, 5, 7 times a day since the day that we were born. And how difficult it is to change a behavior that you have been practicing. There's nothing in your life that you have done more often than eating.
That's true.
So
That's very true.
it's very hard to change that behavior. But the problem is that there are people who are obese. We're just built differently. Their metabolism doesn't handle the food the same way that people who are skinny, no matter. So they need to know. They need to start by knowing that they're different. The same way that some people may have black hair and some people may be blonde. That's very easy to see. You see that on people. But your metabolism is as different as that. People are as different as that. You just don't see it with your eyes. You see it when people eat the same that other people and they gain weight. So they need to learn that they're different in that sense, not in a negative way, but in a way that they need to realize that they need, just because your family is eating the cake, that doesn't mean that it's good for you.
That's right.
You need to find what suits you, but that is healthy for you, and make that your reality. More than saying that change your way of life, that you need to accept that reality. And once you accept that reality, then it's easier to handle the changes and the differences that you have to do. And my main motivator is to ask them always to look at the future. Where do they want to go? What I always ask them, why are you here? And they tell me, well, because I want to lose weight. Tell them, you're not here because you want to lose weight. You're here because there's something that you want in life, and your weight is on the way of getting that. It may be you want to see your young children getting married or play with your grandkids. That is where you want to go. Your weight is the obstacle that won't let you get there. And once you realize that, it becomes your reality, and you can accept your changes.
This show is heard across the country and around the world. And what advice do you have people that are overweight, that are thinking of this, having bariatric surgery? First, would you tell them to try to lose the weight on their own and then come and see you? I mean, what advice is it that you have for them?
Well, they need to start by trying to lose weight on their own, because it's an educational and behavioral thing. They need to learn what they need. They need to learn what it takes, because having surgery won't take you away from that. You still need to learn to eat. It's just part. The surgery is the tool we give you for you to do that. That's the first thing. The second thing is that to talk to their primary doctors and eventually their surgeon, and get evaluated and get educated about the surgery. There are many people that are scared because, of course, it's a surgery. You believe that it's not going to go well. You're going to have complications. But the truth is that when we evaluate this realistically, even though surgery carries its risk, the real risk for you is to remain morbidly obese. That is what is going to shorten your life, and that is what is going to bring back bad things to happen to you. So that's the real risk.
And what is the most interesting case of someone that you do? I know another bariatric surgeon in Miami was taking care of someone that was 450 pounds. I mean, what interesting cases have you seen, and what kind of people have you helped?
Well, my most interesting case was many years ago. I was almost starting to do this, and I had somebody who was way more than that, was close to 700 pounds.
Wow.
But at 700 pounds, we couldn't do surgery on him because the stretcher, the OR table, wasn't rated for more than 500 pounds.
Right.
So what we did with this guy who wasn't able to walk, we had to put two beds together in the hospital. We placed him on a rehab center. We had him on a diet, and we had him lose medically close to 200 pounds, which took him to a 500. Once he got to a 500, then we did a gastric bypass on him, and he was successful. He went down to 200 pounds eventually. So that was the most challenging case, because we took him from the beginning, from when he wasn't even a candidate for surgery. We prepared him for surgery, made him lose weight medically, and then we finished the process by doing surgery successfully.
And that must be very satisfying for you to be able to help all these people that come and see you.
Well, that one was particularly satisfying because then he was hired by the hospital as a guard, so I got to see him every day.
Oh, wow,
so it was
that's
a
awesome.
very satisfying experience.
Good for him. Good for him. We're going to take a short break right now, but when we come back, we're going to talk about some other interesting things that you're working on at Florida Medical Center. So we're looking forward to hear about that.
Perfect.
My dad is a cardiologist, and so I have two brothers, and we were all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
You are listening to Doctors Are People Too with David DePino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Hi, I'm Patty Villa, and you're listening to Doctors Are People Too. I'm filling in for Dave DePino, who's on vacation this week. And with us tonight, we have Dr. Fernando Bayron from Florida Medical Center. The first part of the show, we talked about bariatric surgery that you do. And now I want to ask you about the robotic surgery. What can you do with the robotic surgery at Florida Medical Center?
Well, we have an excellent and very modern system in Florida Medical Center. It allows us to do most of the surgeries that we can do by laparoscopy. We can do gallbladder surgery, we can do hernia surgery, all kind of colon and bowel surgery, liver surgery, reflux surgery, bariatric surgery can be done with the robot also.
And what is the advantage of having the robotic surgery with all these different surgeries that you can do on the human body?
Well, the advantage of robotic surgery is you have to see robotic as an enhancement to laparoscopy. So it is a laparoscopic procedure where the surgeon gets to have a visualization of the surgical field in 3D, in three dimensions, very high def, with perspective of depth. It allows a lot more magnification, and the instruments are more precise. There's a computer haptic system in your hands that your finger movements are translated to the instrument, so they move like if it was a robotic hand inside of the body. So that is an advantage to the patient because it allows you to do more precise dissection, which eventually means less pain, less bleeding, and a more rapid return to your normal life or your job if that's the case.
And you see so many different patients that have so many different, problems, health problems that you want to help them solve. What do they tell you? What is their response to you when you tell them that they're going to be have robotic surgery? I'm sure that some of them must get scared.
It's funny because it goes both ways. Some are concerned about the fact that the surgery is not going to be done by a surgeon; it's going to be done by a robot. And I explain them that's not the case. The surgery is done by a surgeon. The robot is an interface, but the surgeon is sitting at the controls of the robot doing the surgery with all the same skills that they have to use for doing open surgery. So those are the ones that are scared. They're the ones that are excited, that wants not to get any anesthesia until they go to the room and they meet the robot. So those ones are funny too.
Yeah, and you're doing a lot of innovative things at Florida Medical Center. Can you tell us about some of the things that you're working on?
Well, we have with the availability of the robot and the luck that we have with the volume of patients we're able to help. We do very advanced hernia surgery. That is a particular area of interest that I have. I do the regular inguinal or umbilical hernias, but there are people that have had multiple hernia repairs, that have recurred, that have a condition that is called loss of domain. That's where the hernia is so big that they almost have no abdominal wall. Those are hernias that are a stage beyond regular surgery and they require special expertise and equipment. And I have a lot of interest in that. I do a lot of that very advanced hernia surgery. The results are excellent. Patients are able to restore the form and shape of their abdominal wall. And it's important because it's functional too. Sometimes people think about hernias as something just a bulge there that is unsightly. In big hernias, it's more than that. When people have big hernias in their abdomen, that means that they have compromised the function of the abdominal wall muscles. So they have problems standing erect. They have problems to get out of bed. Their back hurts because the back have to take over the function of their abdominal muscles. They have constipation because they cannot generate enough pressure with the abdomen to go to the bathroom. It's a very significant thing for people. They really beg you to fix them because it's more than just a bulge. That is unsightly.
And is there something that you're seeing more common than other at this very moment?
We're seeing more commonly because people are more aware that there is help and they come seeking for attention. In the past, with the surgery open, it was very big. Many were denied surgery by surgeons. Now they come because we have more technology and different procedures that we can do. Have to remember, in the United States, they do millions of exploratory laparotomies every year. Millions of times a year, the abdomen is entered, is violated, is open. Now, the rate of those incisions getting to become hernias is 25 to 30%. So it is calculated that every year there are new 300 to 400 new incisional hernias.
Wow.
So it's a huge problem.
Yes. And what advice do you have for people to come obviously seek help immediately?
To seek help immediately, not wait until they keep, because they will grow with time, and as they grow, they will become more disfiguring and harder to repair, and the chances of success of the repair will be less. So the advice on hernia is, first of all, go to a surgeon with experience the first time, because the best chance of getting a good repair is the first time. Now, if you were not lucky enough to have the best luck the first time, go to somebody with experience as soon as possible, so you avoid it becoming something more difficult to fix or unfixable.
And I want to mention to everyone that's watching us and listening to us this evening that if they want to find Dr. Bayron, they can at Florida Medical Center, they can call 866-498-5433. Once again, 866-498-5433. You know, the show is called Doctors Are People Too. And I wanted to ask you a little bit about, what is your passion? When you're not working, what is your passion?
Well, what can I tell you? My family, I enjoy just being at home, watching TV. My family, when I have a little bit of spare time, I play golf or go to the beach, or going back to my country to see my family and friends.
And where did you go to school?
University of Puerto Rico.
And what specialties did you have? You know, Dr. Eric Beyer, who was a friend of yours, and he was here for the first half hour, was telling us about where he went to school growing up in South Florida, and about, you know, what he liked to do. So what is it? Where did you go to school? Tell us all those details.
I'm a native. I'm original from Puerto Rico. I was born in the West Coast, a place called Mayagüez, a beautiful beach town in the West Coast of Puerto Rico. Whoever have not been there, they're missing something. Beautiful beaches, and close to the famous surfing beach called Rincon. And from there, I went to San Juan to do medical school. After I finished medical school and did my residency in the same place, in the medical center and the VA hospital in San Juan, I remained in the university teaching surgical students and surgical residents for 12 years before moving to the States. Then I moved to the States, and in those years, two interesting things happened. First of all, I learned bariatric surgery out of curiosity. I had a patient that was morbidly obese. I knew that there was something else that could be done for her. Nobody was doing bariatric surgery at that time in Puerto Rico. I went and trained. I went to Brazil and trained. I was able to help that patient, and that started my bariatric surgery career. But in addition to that, I feel lucky because I've been always a fan of innovation and giving my patients the latest technology, be the first to do things. And I feel that I'm accomplished at laparoscopy and now at robotic. But I feel I was lucky at that, because when I started residency, there was no laparoscopy. I did start residency in &88. The first robotic laparoscopic gallbladder was done in '87. So at mid residency, I had not done laparoscopy. I had a lot of experience doing open surgery, and then laparoscopy came. And I got to grow in my practice and get old in my practice parallel to the development of laparoscopy and all the advances. So I feel that that's something that have really mirroring my career, the development of laparoscopy.
No, and while we were sitting here, I just wanted to mention, I know you're a proud father, because your daughter texts you a picture, and what does she say?
First paycheck. My daughter, she just finished dentistry a few months ago, and I try for her not to be a surgeon. That's a tough life. But she ended up, she's doing a residency in surgery, in oral surgery, and she just texted me that she got her first paycheck. So that was funny.
Well, congratulations to you. And I look forward to meeting your daughter. And thank you for being here tonight with us. I sure learned a lot, and I know our listeners did too. I just want to mention that if anybody wants to find Dr. Bayron, they can find him at Florida Medical Center, or you can call 866-498-5433. Wishing you all a very good night.
Good night.
Thank you for listening and watching Doctors Are People Too with David DePino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.